Hello, everyone. I'm Dr. Chetan Bhambure, consultant cardiologist at Wokhard Hospital, Mira Road. I'm going to be talking about ABPM and its importance. ABPM is ambulatory blood pressure monitoring, which provides a 24-hour account of the patient's state and is useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and masked subtypes. It is accurate in predicting the risk of cardiovascular disease and mortality. Blood pressure level measurement during home or ambulatory BP monitoring is recommended in patients with office blood pressure classified as high normal blood pressure or grade 1 hypertension, which is systolic 130 to 159 millimeter mercury and or diastolic of 85 to 99 millimeter mercury. ABPM provides the average of BP readings over a defined period, which is usually 24 hours. The device is typically programmed to record blood pressure at 15 to 30 minutes intervals, sometimes at 1 hour intervals, and average blood pressure values are usually provided for daytime, nighttime, and 24 hours. A diary of the patient's activities during this time and sleep time can also be recorded. A minimum of 70% usable blood pressure recordings are required for a valid ABPM measurement session. ABPM values are, on an average, lower than office blood pressure values, and the diagnostic threshold for hypertension is more than 130 by 80 mmHg over 24 hours, more than 135 by 85 mmHg for the daytime average, and more than 120 by 70 for the nighttime average, which are all equivalent to office BP of more than 140 by 90 mmHg. What are the advantages? It's a better predictor of hypertension-mediated organ damage than office BP. 24-hour ABPM mean has been consistently shown to have a closer relationship with morbid or fatal events. It is more sensitive than office BP for CV outcomes such as coronary morbidity or fatal events and stroke. It can identify accurately white coat and masked hypertension. There is stronger prognostic evidence. The nighttime readings are available. There is measurement in real life settings. There are additional prognostic BP phenotypes which are available. And there is abundant information from a single measurement session, including short-term blood pressure variability. The only disadvantage is it's slightly expensive and sometimes the availability is limited and it can be uncomfortable. ABPM has become an indispensable tool in the diagnosis and management of hypertension and its therapy. Recent guidelines from the European Society of Cardiology recommend that diagnosis of hypertension should be based on repeated office BP measurements or ABPM if feasible. Analysis of various indices on the ABPM graph, such as hyperbaric index, diurnal index, dipping, and other indices, can provide useful information about the prognosis of diseases such as hypertension, diabetes, chronic kidney disease, and so on. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ABPM is the single most effective tool to diagnose white coat hypertension, masked hypertension, nocturnal hypertension, and can help direct the treatment in such patients when required. Overall, ABPM readings can guide towards the prognosis of underlying organ damage and can be a useful predictor of cardiovascular risk. Therefore, in any patient suspected of hypertension, ABPM or ambulatory blood pressure monitoring is a must. Thank you very much.